Ever wondered about the advancements and innovations transforming the world of surgical procedures? Welcome to our journey into the cutting-edge world of modern surgical techniques. Surgery is a cornerstone of medical practice, often a vital intervention when other treatments don't yield results or when swift action is required to prevent further complications. From trauma surgeries to disease management, congenital condition corrections to cosmetic enhancements, surgical procedures cover a broad spectrum. But what's truly fascinating is how technology is reshaping this field. In this video, we will delve into the exciting realm of robotic surgery, image-guided procedures, the role of 3D printing, and the emerging use of augmented and virtual reality in surgical training and planning. We'll also spotlight some real-life cases where these technologies are making a remarkable difference. Whether you're a medical student or just curious, you're in for a treat as we explore the fascinating world of modern surgical techniques. What exactly is surgery and what does it entail? Well, surgery is a branch of medicine that focuses on the treatment of injuries, diseases, and other disorders by means of operative procedures. These procedures can be performed either manually or with the aid of instruments, depending on the complexity and nature of the condition. The journey to surgery typically starts with a diagnosis. This is when doctors identify the problem through various tests and examinations. Once a diagnosis is made, the surgical team develops a comprehensive treatment plan tailored to the patient's specific needs. Pre-surgical planning is a crucial step. It involves a detailed discussion between the patient and the surgical team about the procedure, its benefits, potential risks, and alternatives. The goal is to ensure the patient is fully informed and comfortable with the process. Once the surgery is scheduled, the patient undergoes a pre-operative assessment. This includes a thorough medical evaluation to ensure the patient is healthy enough for the procedure. It also involves preparing the patient both physically and mentally for the surgery. The surgical procedure itself is conducted in a sterile environment, usually an operating room. The patient is administered anesthesia to ensure comfort and painlessness during the operation. The surgeon then performs the procedure using a variety of instruments and techniques. Post-surgery, the patient is taken to a recovery room where they are closely monitored until the effects of the anesthesia wear off. The recovery process also includes pain management, wound care, and physical therapy if necessary. Follow-up appointments are scheduled to monitor the patient's progress and address any concerns. Surgery is not just about the operation. It's a comprehensive process that involves a team of healthcare professionals working together to ensure the best possible outcome for the patient. It's a combination of science and art, where precision, skill, and compassion come together to heal. It's also a field that is constantly evolving, with new techniques and technologies being developed to improve patient outcomes and make surgeries safer, more efficient, and less invasive. Now that we understand what surgery is, let's discuss when it becomes necessary. So, when is surgery the best course of action? Well, simply put, it depends on the individual's health condition and the severity of their symptoms. There are several circumstances where surgery becomes the go-to solution. One such situation is trauma. Accidents can cause severe injuries that might require immediate surgical intervention. This could range from fractures that need to be reset to internal injuries that need to be repaired. In such cases, surgery can be a life-saving measure. Next, we have diseases. Surgery can often be the most effective way to address certain medical conditions. For instance, tumors can be surgically removed to prevent the spread of cancer. Organs damaged by diseases like appendicitis or gallstones can also be treated surgically to alleviate symptoms and improve the patient's quality of life. Congenital conditions, or those present from birth, often necessitate surgical correction. For example, congenital heart defects or a cleft palate may require surgery to improve function and appearance. These surgeries are often performed in the early stages of life to prevent further complications and allow the child to develop normally. Lastly, cosmetic enhancement is another area where surgery comes into play. While not medically necessary, cosmetic surgery can significantly improve a person's self-esteem and quality of life. Procedures like rhinoplasty, breast augmentation, or liposuction are performed to enhance physical appearance and boost confidence. But it's important to remember that surgery isn't always the first line of treatment. It's usually considered when other therapies have failed, or when the condition is severe enough to warrant immediate intervention. And of course, the decision to undergo surgery should always be made in consultation with a healthcare professional. They can provide detailed information about the risks, benefits, and potential outcomes of the procedure, helping patients make informed decisions about their treatment. As we can see, surgery plays a critical role in various medical circumstances. But how has it evolved with the advent of new technologies? Stay tuned as we delve into the incredible world of modern surgical techniques and innovations in our next segment. From robots to virtual reality, let's delve into the latest technologies in surgery. These advancements are transforming the landscape, making procedures safer, more accurate, and less invasive. First up, we have robotic surgery. This isn't about machines taking over the operating room, but rather, it's about enhancing the surgeon's capabilities. Robotic-assisted platforms like the Da Vinci surgical system provide surgeons with superior 3D visualization and improved dexterity. These systems enable surgeons to perform complex procedures with smaller incisions, leading to less post-operative pain and quicker recovery times. Next, we have image-guided surgery. This technology combines real-time imaging, like MRI or CT scans, with computer navigation systems. It's like having a GPS for the human body. Surgeons get detailed anatomical information during the procedure, which improves accuracy and reduces the risk of complications. This is especially useful in intricate operations involving the brain or spine. Then there's three-dimensional printing, a game changer in the surgical field. With 3D printing, surgeons can create patient-specific implants, surgical guides, and even detailed anatomical models. This technology allows for personalized treatment plans, and surgeons can even practice the procedure on the 3D model before the actual surgery. Last but not least, we have augmented reality and virtual reality. These technologies are making their way into surgical training and planning. Surgeons can visualize and practice procedures in a simulated environment before stepping into the operating room. This immersive experience enhances surgical skills, improves patient safety, and reduces the learning curve for complex surgeries. Impressive, isn't it? These technologies are not just concepts from a sci-fi movie, they're being used in real-life surgeries. They are not only revolutionizing the way surgeons operate, but also dramatically improving patient outcomes. The future of surgery is here, and it's fascinating. Let's take a look at some real-life examples of how these technologies are transforming surgical practice. First up, robotic-assisted cardiac surgery. In these operations, surgeons are harnessing the power of robotic systems to perform intricate heart surgeries with an unparalleled level of precision. Take, for example, coronary artery bypass grafting, commonly known as KBG. This procedure involves grafting a healthy blood vessel from another part of the body to the coronary artery to bypass a blockage and restore blood flow to the heart muscle. With robotic assistance, surgeons can perform this complex operation with smaller incisions, leading to less pain, fewer complications, and a quicker recovery for the patient. Next, we have image-guided neurosurgery. This is where the magic of real-time imaging and computer navigation systems come into play. In these delicate surgeries, every millimeter counts. Damage to critical structures in the brain or spine can have serious consequences. But with image-guided systems, neurosurgeons can navigate the complex terrain of the brain and spine with greater safety and accuracy, resulting in improved patient outcomes. Finally, let's talk about 3D printed implants. Orthopedic surgeons are using this groundbreaking technology to reconstruct bone defects and improve the fit and function of artificial joints. For instance, in a total knee replacement, a 3D printed implant can be custom-made to match the patient's unique anatomy, leading to a more natural-feeling joint and better post-operative mobility. These case studies are just a few examples of how advancements in technology are revolutionizing the field of surgery. By harnessing the power of robotics, real-time imaging, 3D printing, and more, surgeons are able to perform complex operations with greater precision, leading to improved patient outcomes. The future of surgery is here, and it's nothing short of amazing. These case studies demonstrate how advancements in technology are revolutionizing the field of surgery and improving patient outcomes. So, what does all of this mean for the future of surgery? It means that we're in a remarkable era where technology and medicine are converging to redefine the boundaries of what's possible. We've journeyed from understanding the basics of surgery to exploring the conditions necessitating surgical intervention. We've marveled at the latest technological innovations, from robotic-assisted surgery to 3D printing, that are transforming the surgical landscape. These advancements are not only enhancing surgical precision but also improving patient outcomes. We've seen real-world examples of how these technologies are already being used, transforming lives and making once complex procedures more accessible and safer. And remember, we're just scratching the surface. As we continue to innovate and explore new technologies, the future of surgery is brighter than ever. Thanks for joining us on this intriguing journey into the world of modern surgical techniques.